everyone, my name is Sarah Bond and I am a senior at Duke University studying public policy and global health with a minor in Spanish. And today I am going to walk you through my experience working with the Duke-Margolis Center for Health Policy. All right, so before I dive into my timeline of experience with Duke-Margolis, I wanted to provide a bit of background about myself. So I started at Duke in fall 2017 thinking that I wanted to be pre-med, but through the coursework that I took that first semester, I quickly realized that I was more interested in the policy of health than the biology of it. And so I expressed that interest to my friends, and one of my friends who was still on the pre-health listserv heard about this opportunity to work at the Duke-Margolis Center. And she immediately thought of me, and she was right to do so because it was right up my alley and really allowed me to dive into the field of health policy. So I worked with Duke-Margolis in the DC office last summer on the global team, which I'll get into a little bit more later. And then after working in DC, I studied abroad. And when I returned from abroad, my mentor, Andrea Toomey, connected me with another previous and actually current Duke-Margolis intern, Sahil Sandhu, who co-founded an undergraduate club called the Duke Student Collaborative on Health Policy. So through my connection with Duke-Margolis, I was able to discover this opportunity to be co-chair of SCOPE's Career and Professional Development Committee. And on that committee, we're also maintaining a close relationship with Duke-Margolis' education team to plan numerous events, including a case competition, which is the biggest one that I am involved in. And then this summer, I have continued my relationship with Duke-Margolis by interning on the global team again, but this time virtually, given the current COVID-19 pandemic. And through all this work, I have reaffirmed my desire to have a career in healthcare. I really loved working with people from so many different backgrounds, and it's shown me that working in healthcare will allow me to have an interdisciplinary career, which is something I've always wanted. So as mentioned, a little more detail on my time in the DC office. I really enjoyed this experience because I got to meet people with established careers in health policy in the office and also through events that I was able to attend in DC. So that was a huge benefit, was being in the city where American policy is created. I really love that. And one event in particular that stands out is we attended a World Bank event in which the director, Dr. Mark McClellan, presented on value-based care in low-resource settings. And the reason this event was so rewarding was because I was able to contribute to some of the slides that he presented. So seeing some of my own work being presented in this room of powerful stakeholders really proved to me that I can have an impact in this field of global health policy. Now moving on to this summer. So this summer I worked on two projects. One was a systematic review of the impact of value-based care on health disparities in the United States. And this project I really enjoyed for two reasons. One is the topic itself. I became interested in health policy because I wanted to improve equity in this space. And I really believe that this review will help to do so. It investigated one mechanism that may reduce health disparities. And the other thing that I found really rewarding about this project was the team. Before starting this virtual internship, I was worried that there wouldn't be as much of a spirit of collaboration because it was virtual, because we weren't all in the same office space, but I was really proven wrong. Through this project, I was able to continue working with the global team, with Andrea, Jonathan, and Yolande, who are on the left of this slide, which was really incredible to continue fostering that relationship. And I was even able to spark new relationships with Osandu and Wenwi, who are on the right. And this really surprised me because I wasn't sure if I would be able to have as deep of a connection with somebody when we were only talking over the computer screen. But I truly believe we were. And through weekly team meetings, we were able to progress this project quite a bit and are aiming to publish it in the near future. And the other project that I worked on this summer was another literature review on the enabling policy factors and barriers to cervical cancer screening and treatment in Peru. And I found this project very interesting because I was not very familiar with the Peruvian health system prior to working on it. And through this project, I was also able to access a Peruvian Ministry of Health database with all the policies in Spanish. And that was really cool for me because I have studied Spanish since the 7th grade, and being able to apply that in a way that is useful and impactful was really incredible. Other elements of this internship that I really enjoyed was connecting with the other interns. So again, I was worried that it wouldn't be the same virtually because last summer I had like lunches in the office with all the other interns and really got to know them. But I was able to get to know these interns virtually as well, particularly through Journal Club and through presentations, and also through a weekly lunch that I had with some of my fellow interns and some Duke-Margolis full-time employees. Finally, I really enjoyed coffee chats that were set up by my mentor, Andrea Toomey, with other established women in the field of health policy, along with young women at Duke-Margolis. And I really enjoyed these because I got to hear about how other women have overcome obstacles in this field and have progressed throughout their career in health policy. And it kind of proved to me that I am able to have a really incredible career in health policy someday if I set my mind to it. So all of those experiences were definitely highlights from this program. So where do I plan on going from here? Well, first, I aim to publish the reviews that I conducted this summer with my teams. I also plan on continuing to work with the Duke-Margolis education team to plan the case competition and other events with the undergraduate club, the Student Collaborative on Health Policy. And finally, I am graduating in May 2021, which is kind of crazy. And when I graduate, I plan to establish a career in healthcare to continue doing this work that I love. So thank you all for listening to me. And if you have any questions, don't hesitate to reach out. My email is right below.